From 2013 to 2019, the Swiss Research Institute of Organic Agriculture and their partners ISIPE, CALO, OACK and OCA conducted a comparative research on productivity, profitability and sustainability of organic and conventional farming systems. Since 2019, 2 follow-up projects, PMCA and Nutridecision, have been initiated in Murang'a County. The Nutridecision project has analyzed the dietary diversity and nutritional practices and decisions among organic and conventional women farmers in the county. We have the Director of Organic Consumers Alliance. Welcome.
Thank you.
Please tell us your name and the role you have in this project.
Okay. Thank you, Mercy, for asking me to introduce myself. It's a privilege in this fresh air in the Murang'a neighborhood in the middle of a farm. First I want to say thank you for the opportunity to have a discussion with us and to share a few things about this project. My name is Dr. Peter Mokaya. I'm the Director of Organic Consumers Alliance, which is an organization that promotes awareness creation, evidence-based awareness creation on the benefits of consuming agroecologically grown food, which is also packaged as organic foods via an organic farming system.
Okay, so thank you for the introduction, Dr. Mokaya. Safe food, nutrition and health are some common factors why farmers are leaning towards organic farming, and I'd like to know what your take is on that.
Thank you, Mercy, for asking that question as well. Basically, from where we stand or where we sit currently, if you want people to change behavior, you have to give them information. And to give them information, you have to create awareness. And to create awareness, you have to provide evidence of the benefits of shifting from one food system to another food system, or the reason why you should grow food and consume food in one way as opposed to another way. And that's why in this particular project, there was sort of like a comparison between growing food and consuming food that's grown conventionally, and growing food and consuming food that's grown organically. And this farm where we're sitting right now, you may not see the whole area, but it's full of diverse food. The nutritional products that come here from the perception that have come out from the findings is that farmers in this part of the Murang'a are shifting towards growing food that's diverse, that's more nutritional, and that's safe because it's grown organically.
I have some follow-up questions on that statement. You've mentioned that you need to present evidence.
Yes.
What kind of evidence have you given these farmers to shift from what they were doing before to what they are doing now? And the second question would be, what kind of foods are they now growing that you maybe recommend to other people who want to make the same transition?
Thank you. Yeah, that's true. That question is indeed relevant because people don't change because Dr. Mokaya has told them to change or Mercy has told them to change.
Yeah.
They change because they are convinced that there is a good reason to abandon the old and to adopt the new. And in this case, from the findings of the Nutridecision or nutrition's comparative study that was done in this part, the findings seem to indicate that many farmers have perceived benefits of growing food organically through the entire value chain. What do I mean by entire value chain? From the way they produce the food, the inputs that involve composting and so on are cheaper. So there's an aspect of more profit. And also that they are now growing a bigger, diverse range of foods. I'll mention some of them later on. Instead of consuming sukuma and ugali all through, they now have a bigger range, including a bit of traditional vegetables like the sagas, the manogus, the spinach. Of course, again, they don't have the chemical contamination because they are grown without using the conventional spraying, which is very key. So the food is safer. And they themselves, from the findings of the study, which participants were mostly women in the reproductive age group between the age of 15 and 45, some of them, as in some of the components of this discussion we're having, because other people will discuss different components, the farmers, dairy farmers, and one of the gentlemen will discuss, and Dr. Morioki of Karo will also bring in policy issues in parts of this same discussion to share the findings of those perceptions from the farmers in the part. And it has to do with healthier food, more diverse, less diseases, especially they mention diseases like cancer, they mention diseases like diabetes. They are saying that they're seeing a lot of people dying or getting infected, getting these diseases, which are related to food that they believe is because of the contamination from the agrochemicals. So this is a big motivation, the fear of diseases like cancer that they are seeing increasing, and which they associate from the findings with growing food conventionally, aka with using sprays. So these are the motivations that are driving them to shift farming into more organic and increasing the variety, the diversity. Not just the vegetables, but also the animals. And some of the findings show that they chicken, they have eggs, they keep small animals like goats and sheep, and some of them a cow here and there.
Thank you so much for that. And I wanted to follow up about the medic angle.
Yes.
So how can you draw a straight line between what they eat and how their bodies behave towards a certain kind of food?
Yes.
Yeah.
Yeah. As a public health physician and a promoter of nutrition, a healthy diets and wellness, we know that you are what you eat. They say garbage in, garbage out, and indeed the so-called father of modern medicine, not Hippocrates, famously said that let food be your medicine. That's a very clear connection. So as a physician, when we graduate from medical school, we swear to the Hippocratic oath. Yeah, that man Hippocrates informs how we practice our medicine. Do no harm. Make sure the food is safe. And one way of making sure the food is safe, is sustainable, is nutritious, is diverse, is local, is healthy, is by encouraging farmers to grow food in sustainable ways. Organic agriculture allows the soil to regenerate, for the bacteria to do their job and to nourish the root systems of the plants. The plants then are healthy, they're not malnourished. These plants are eaten either directly by human beings to give better health, which manifests as less disease, more ability to protect oneself from these diseases. And of course for animals, if they eat healthy foods and plants and so on, and plant products, the animals are also healthier. I talked about eggs, talked about the chicken, talked about the milk. If it's preserved, grown well, it nourishes and ensures that people are healthy. So that instead of managing diseases, we manage health. So the whole reason why our team from Organic Consumers Alliance is part of this project that goes all the way to Switzerland, the Swiss Organic Research Institute, and many other partners, including Caro, and of course OAC, which represents the community members, the farmers, is because we believe that together we can achieve many other objectives, including the objectives of increasing food safety, which of course leads to food security. Because the definition of WHO of food security, part of it includes food safety. Therefore, I would say without safe food, you can't achieve food security. And without food security, you can't have healthy people. I hope I've done justice to that question.
Yes, you have. And you've answered the follow-up question I was going to ask about safe organic food. How do you ensure that? And maybe we can just close off with a remark from you.
Yes, thank you, Mercy. I could make many remarks. I'm given to mic talk, but this is not my time to say many things. Just that right now, the whole world is seized with this fear of the pandemic of COVID-19.
Yeah.
Healthy food is not only good for preventing chronic diseases like diabetes and cancer, but also for strengthening the immune system to protect us against infectious diseases, including COVID. Recently, we completed a book that shows that you can actually reduce the risk of COVID infection, COVID disease. With a small book here that, if you allow me, I can share with the audience.
Yes.
We wrote this book with
a mini barefoot guide.
Yes.
Agroecology series, surviving COVID-19.
Yes.
The neglected.
Yes. So this book is available for free. You can download it from our website, www.organicconsumersalliance.org, which basically says food is medicine, and this is where sustainable, agroecologically grown organic foods that are local, that are diverse, that are available, prepared in an indigenous way, they strengthen the immune system, and they therefore protect us or prevent infections. And where infections occur, they actually strengthen your body to the extent that you will not have symptoms of the disease. Therefore, this is my sharing, that let's try and put on the inner mask before we wear the outer mask.
Yeah.
And as you can see, I didn't forget to carry my outer mask.
Yeah.
But I'm saying, before we do that, let's consume these foods that are healthy, so that we wear the inner mask before we wear the outer mask.
Yeah.
Thank you.
Thank you so much for your time, Dr. Mokaya. It has been a pleasure hearing from you.
Thank you. Thank you, Mercy.